Hello, my name is Casey Smith. I'm a student with Maryville University, and today I'm going to be doing my cranial nerve assessment. That's nerves 1 through 12. We're going to go ahead and do our pulse assessment, and we're also going to do a reflex assessment today. This is our patient, Heidi Smith, and we've already gone and done cranial nerve 2, which involves the Snellen chart, which assesses for visual acuity, and the Rosenbaum chart, which assesses nearsightedness, and those findings were appropriate. First, we will start with cranial nerve 1, our olfactory nerve. I'm going to have her close her eyes and then close one of her nares. And we're just going to have her smell this. Can you tell me what that is?
Alcohol.
Okay, and then go ahead and keep your eyes closed and do your other nair. And tell me what that is.
Alcohol.
Okay, great job. Okay, now we're going to move on to cranial nerves 3, 4, and 6. These have to do with the eyes. We're going to go ahead and use the tip of our pen light today, and we're going to have the patient follow the pen light with her eyes. And we're going to go through all 6 fields of gaze, and then I'm going to also check her direct and consensual pupillary response. So we'll start in midline, and we'll go to the right and up, and then down and back to midline, and then up, and then down and back to midline, and then we'll just go in just a minute or just a second to make sure that her eyes cross, and they did appropriately. In this case, we're going to go ahead and check that pupillary response. We're going to check for that direct and consensual. So initially, we're going to shine the light into her eyes, looking for the direct on the eye that we're shining the light into, and then the consensual on the opposite eye. And then our direct, and then consensual. And some patients don't tolerate the light as well, so make sure that you give them a break as needed. So our next nerve that we're going to assess today is the trigeminal. With the trigeminal nerve, we want to make sure that we're checking our patient's facial nerve. So we're looking for our muscle structure. We're looking for any asymmetry in her face. We're going to go ahead and check the temporal mandibular joint. So go ahead and open your jaw and close it. And there's no popping in her jaw. Is there any pain?
No.
Okay. So we're also going to go ahead and check her sensation at this point. Go ahead and close your eyes. Tell me when you feel this.
Yes. 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 Yes.
Okay. Great job. Okay. So next we're going to move on to cranial nerve 7, which is our facial nerve. And we're going to go through a few motions on her face. We're going to have her crinkle her forehead and then shut her eyes tight. Can you smile for me? Okay. And then can you puff out your cheeks? Great job. Okay. And next we're going to move into cranial nerve 8, which is acoustic. So we'll start by first doing the whisper test. And I'm going to go to her right. I'm going to have her cover her left ear, and I'm going to whisper a word.
Pear.
And then she's going to repeat that word if she hears it. And so again, we're going to do this on the opposite side. She's going to close her opposite ear of where I'm at.
Orange.
Again, I'm going to say a word, and she repeats that, and that was very much appropriate. Next, we will do the Rhine and Weber test that are associated with this exam. We will smack our tuning fork on her hand. We will put this to the top of her skull, and she will tell us whether or not she can feel this bilaterally in both ears.
Yes.
Okay. And then again, we will stop it, hit this on our hand. We will go back here to the occipital bone, and just tell me when you stop hearing that.
Yes.
Okay.
Yes.
So what we've done is we put that to the side of her ear. So we've checked the bone conduction and the air conduction, and our air conduction should be twice as long as our bone conduction. Okay. Next, we're going to check cranial nerves 9 and 10. These are our our glossopharyngeal nerve and our vagus nerve. And what we would do is we're going to assess her gag reflex as well as the rise of the uvula in the back of her throat. Go ahead and open your mouth for me and say ah. Okay. Okay. So her uvula rose appropriately in the back of her throat, and we did get that gag reflex appropriately. Next, we'll assess her spinal accessory, which is cranial nerve 11. And we'll do this. Go ahead and raise your, okay, And turn your head this way, and then the other way. Great job. So now we're going to do that with resistance. Go ahead and raise your shoulders. Good job. Okay, and this way. Great job. And then we're going to move to cranial nerve 12, which is the hypoglossal. And this involves the tongue. And so we're just going to have her stick out her tongue, and we're going to have her move it from left to right. And we're going to look for any signs of lesions or anything like that, maybe signs of her inability to move it appropriately. So go ahead and stick out your tongue for me. And go ahead and turn it to one side. Okay, and the other side. Okay, great. Okay, next we're going to assess her pulses. We're going to do the brachial, radial, popliteal. We're going to do the tibial, and we're also going to do, oh my goodness, I forgot it. So let's go ahead and work through those. It's on the top of the foot. So we're going to do this bilaterally, and we're not going to use our thumb because there is a pulse rate in our thumb. I'm just going to feel that. There we go. So this is our brachial pulse. Okay, and we're going to go ahead and feel this, our radial pulse here. Okay, and then we're going to go ahead on this other side again and feel the brachial pulse and that radial pulse again. Okay, so we're assessing for strength or weakness. In this case, she is a 2, normal findings. Okay, then we'll go to the back of the knees and we'll try to find this popliteal. Sometimes this can be very difficult to find. And there we are. Again, I can feel it appropriately. I would grade this as a 2. We'll go back here to the tibial, posterior tibial pulses. And then we'll come up front here to the pedal pulses. Okay, and I can feel all 4 pulses really well. Next, I'm going to move to the reflexes. And so we're going to assess for brachial reflex. And we'll just have the patient relax their arm as best they can. This is not always the most comfortable test. Okay. So what we're looking for is we're looking for a reflex response. And so hers is appropriate. We're not seeing a huge hyperreflexia. We're not seeing a hyporeflexia. So again, we're just going to have the patient relax her arm. And down here at the radial reflex. And then we're also going to assess the Achilles reflex. And what we would do is we would actually grab the patient's foot like this, and we would check for this Achilles, the Achilles tendon on the back of the leg, and we'd go ahead and just smack that. And we're looking for that, just that little foot jerk in the back of or here in the front under our hand. Again, on this side. Okay. And so it definitely drops there as well. Again, no hypo or hyperreflexia with that. Thank you for watching today. Hope you learned something. I did. Thank you. Bye.